Good afternoon. We once again find ourselves here on the floor of the U.S. Congress, and the subject before us, in spite of considerable various events that have been of great interest to people yesterday, I'm thinking of the election in Massachusetts, still remains the question of health care. There's discussion with the new political realignments that it may be that the House will take up and just pass the bill that was passed by the Senate. That is one possibility, which then, of course, would require the bill not to have to go back to the Senate. And so we come back to this question of health care in America, something that has a lot of people's attention. It's not the top priority, I think, for many people. I think many people are worried about unemployment. They're worried about the economy. They're worried about excessive government spending. They're worried about terrorism and national security. But underneath those, perhaps, there is still some concern about health care, but particularly a fear that in an attempt to try to solve a problem, we may make a bad situation worse. Indeed, when government does too much, we have found that we sometimes get some very bad side effects. Inferior quality, inefficient allocation of goods, bureaucratic rationing, and, of course, excessive expenses. Now, if health care is expensive now, just wait till it's free, some have said. We were promised by our president, here's what you need to know. First, I will not sign a plan that adds one dime to our deficits, either now or in the future, period. Sounds pretty definitive. Sounds like he says, hey, I understand about the deficit. I understand about the debt. I understand about excessive spending, and I'm not going to add one dime to our deficit. Well, the bill that's being proposed does not add a dime, so I guess technically this statement is correct. It adds rather either one or several $1 trillion. That may be a whole lot worse than the dime. So this particular statement, along with some others that we have heard, is not really precise in terms of what has been proposed, particularly the Senate and the House versions that we have seen. It does, in order to try to put a package together, there have been some compromises made, as tends to happen when you're writing large and complex pieces of legislation. This protects insurance companies in kind of an odd way. The legislation that is being considered in the Senate preserves the legal immunity of large insurance companies in the event of negligence or any other wrongful action, even if their action results in injury or death of a patient. Now, this is a language that's in the bill. What does that really mean? What it means is something that I think most Americans consider to be very undesirable, and that is, you walk in and you feel sick and you go see your doctor. You trust your doctor. You've known your doctor for some period of time. And so you have the doctor take a look. He runs some tests. He says, well, now, Congressman Akin, this is the news. You got this, this, and this, and I recommend we do this. And you check with him, ask a bunch of questions, and say, good, it seems like a good course of action. Now here's where the train comes off the tracks. Your insurance company says, but we don't really think that's necessary. We're not that concerned about you, Congressman Akin. And your doctor, well, you know, he's probably being pretty cautious, but he's also being pretty expensive. And so we're going to say you really don't need to go to the hospital for this. We're going to recommend you just stay home for a while and take some aspirin and see what develops. Now, that's what we call something or somebody getting in the way of the doctor-patient relationship. In this country, we have gotten spoiled. We have enjoyed contact with our doctors. We have enjoyed the process of getting to know the doctors and trusting them and soliciting their opinion. At times, we get multiple opinions from different doctors just to make sure. But we don't want some insurance company coming between the patient and the doctor. That's pretty bad when that happens. What's worse is when the government comes between you and your doctor. That's what a full-bore socialized medicine bill will do. But this bill here says that these insurance companies can basically second guess the doctors, and if things go wrong, guess what? They have no liability. Is that what we want in health care reform? I don't think so. Doctors can be sued if they make a bad diagnosis, but not insurance companies, even when they get in between the patient and the doctor. Is that something we want in a health care bill? I don't think so. And that's one of the reasons why a lot of Americans don't want this massive government takeover to pass, because it has these little loopholes like this in it. I don't think many of you would have known that that was in the bill, and yet it is. There are also some other problems. We have a bill, when you start to get thousands of pages of legislation, there are a lot of room for mistakes and an awful lot of creation of bureaucracy. And we've got here, and I don't know what the latest version of this, because a lot of this is negotiated behind closed doors, but we're talking about close to 2,000-page bill passed with I don't know how many hours of public review. 72 hours would be nice. I'm not so sure we'll have that. We have not had that on other major pieces of legislation. This particular bill creates 118 new boards. That sounds like some bureaucracy, doesn't it? Commissions and programs, and full of new mandates. One of the things in legislation that people who are legislators pay attention to is how many you musts and you shall and you got-tos that there are in a bill. This one contains the word shall 3,425 times. Obviously, somebody has very strong opinions about what other Americans ought to do, and they're going to mandate it. And so you have here quite a large bill, many, many pages, 3,425 shalls, 118 new boards, and we tried to draw a picture of what that would look like. Now, you know, they say a picture is worth 1,000 words. I don't know if this picture is worth 1,000 or 2,000 pages, but this is an attempt at drawing a picture of what we've got. And the more you look at it, and the more you look at all these colored boxes, which are some of the new agencies and all, it starts to look more and more like some sort of a maze. And you kind of wonder whether what's going on is the consumers, the people who are sick, are somehow trying to get across this maze to find their doctor. It's almost like something you'd be given at a doily in a restaurant with a crayon, and you're supposed to plot the path, if you're a patient, to somehow get over to see a doctor. But this is the kind of complexity that's being created by what has been proposed over the last 7 or 8 months by the Democrats. And the reason this is so complicated is because of the overall strategic approach that healthcare started. And that was the idea: we're going to take what we have and pretty much pitch it, and we're going to redesign the whole thing and put the government in charge of it. So this was not, we're not going to go in and fix this or that that's broken. We're going to basically scrap it and start over. Consequently, the result is a very complicated piece of legislation for the government to try to take over what is essentially close to a fifth of the U.S. economy. And so that's one of the things that people are concerned with, and one of the reasons why, not so much based on political party, but just based on good old American common sense, that there is a concern for the complexity and, of course, the costs associated with that complexity. We don't like mandates a whole lot. Americans tend to be a little bit freewheeling. They're not too much into following all the dots and tittles and all of the little nuances of laws and rules. Americans like to have some freedom, a little bit of elbow room, a little flexibility. So when we're talking about the mandate, we're saying here there's mandates in this bill. All those shalls come into things that restrict your freedom. One of the mandates is that employers must offer a qualified health care plan to full and part-time employees. So we're saying to companies, we don't care what you think is good for your employees, and we don't really care what your employees think is good for them. What we're going to do is tell you how it's got to be. And so we're going to write what your health care plan has to look like, and then, Mr. Employer, you have to offer what we're writing up for you to your employees. That is an interesting approach.